My name is Mary, and this is the Mindful Insights, where I talk about the awareness of mental health issues in today's society, along with ways that it can be tackled to have a good mental health. Before I begin, I'd like you to please subscribe to the channel to receive more content that will be beneficial for you and your family. So let's get right into it. Schizophrenia is a serious mental illness that is characterized by disconnection from reality or having significant changes in thinking, behavior, and emotions. It is also a complex disorder and a significant public health issue in Nigeria that affects about 1% of the global population, and it typically develops in the late teenage years or early adulthood. There are only a few reports of schizophrenic patients in Nigeria due to a lack of news coverage of mental health issues. One of them includes a chief medical officer in Benue State, Dr. Trevor Simon Chishi, who got diagnosed with schizophrenia back in the 1990s. According to World Health Organization reports, he had to suspend school for a full year to get medical treatment. When describing his journey to recovery, he stated that it was a rough time to deal with the disorder, but with the symptoms under control, he was able to help others who were also diagnosed with the same issue among others. There are several potential challenges to addressing schizophrenia in Nigeria, which includes the lack of access to mental health care, stigma surrounding mental illnesses, along with limited funding for mental health services. In addition, cultural beliefs and practices may impact how schizophrenia is perceived and treated in Nigeria. Dr. Dapo Adebaju, a consultant psychiatrist in the Federal Neuropsychiatric Hospital in Yaba, stated that Nigeria, with a population of about 170 million people, has about 1.7 million people suffering from schizophrenia. He further stated that about 50% of schizophrenic people still do not have the right information. Symptoms of schizophrenia can be divided into two categories: positive symptoms and negative symptoms. The positive symptoms refer to the abnormal behavior or experiences that are not typically seen in healthy individuals, such as delusions, hallucinations, and disorganized thinking and speech. Negative symptoms refer to a deficiency or absence of normal behaviors and experiences, such as a lack of motivation, social withdrawal, and difficulty with communication. The impact of schizophrenia can be significant, as it can lead to social isolation, difficulty functioning in daily lives, along with an increased risk of other health problems. This mental health remains an issue in today's society as it hinders people's progress in their day-to-day activities. However, this does not stop psychologists or doctors from looking out for solutions that will help them to alleviate this issue. Treatment for schizophrenia typically involves a combination of medication and therapy. Antipsychotic medications are the most commonly used treatments for schizophrenia and can be effective in reducing the positive symptoms of the disorder. That brings us to the end of today's episode. My name is Mary, and this is the Mindful Insights. See you next week.